Hello, welcome. Dr. Anthony Gonzalez again here for Miami Community Health. Obviously, so excited to bring you another health important topic for you to enjoy today and learn about. I really brought a friend, a mentor, somebody who has guided me in 20 plus years of my career. I brought with us today Dr. Niberto Moreno. Welcome, Bert.
Thank you for having me, Tony.
All righty. So Dr. Moreno was the chief of cardiac surgery at Baptist for many, many years. He was the chief of surgery at Baptist for many, many years, a leader. And now he's gone on to bigger and better things. And I thought we'd bring him. So first we can meet him and know a little bit about him. And then he could talk to us about heart surgery and what is revolutionized in heart surgery. And then talk a little bit more. We have a nice, interesting topic for you today that doesn't have to do necessarily with heart surgery. So, Bert, why don't we start off? Just tell everybody what you did for 30 plus years in our community.
Well, I grew up in Miami and I always wanted to return. So in 1987, after a long tenure with studying and doing my residency, my family and I returned to Miami, where our folks were and where I really grew up. So we returned to Miami, and my dad always wanted me to practice at Baptist Hospital. So he got in good with the chaplain, and the chaplain got me a job with a very good heart surgeon named Roger Sherman. And in 1987, we started our practice here, and been in Miami since then in one institution for 34 years, which is, believe it or not, a lot to say for heart surgeons, Tony. Heart surgeons tend to jump around from one place to another. And we've been comfortable in this area for that long. And I love Miami, and as the baseball player said, and I love the community, and I've made tremendous friends in the community, and hopefully I've done some good to a lot of people in the community. We started heart surgery here in 87, and through May of last year, as you know, when I stepped down from doing heart surgery, we've been very involved in the whole practice of heart surgery from its beginnings. I trained at Loyola in Chicago, where we did 3,000 open heart surgeries a year, which is a major program with heart transplants, lung transplants, et cetera, and moved to Miami. And in Miami, we've tried to keep up with the times in heart surgery. Heart surgery has turned around tremendously to an operation where at the beginning was very difficult. The results weren't that good, to over the years, an operation that's pretty routine. With a mortality rate, which we held at Baptist under 2%, which is equal or better than the national average. During that time, as you know, Tony, we were very involved in something you got involved with, which is robotic surgery. We got involved with minimally invasive heart surgery. Obviously, patients want to have less pain. They wanted to have a shorter recuperation time. And since 1996, when we commenced the minimally invasive heart surgery at Baptist, we did that for many years. And now I've passed it on to the people that are there now. Also, we, as you know, we got involved in the bloodless program, so that we treated people with that are Jehovah's Witnesses with bloodless surgery. And we said, well, listen, this ought to be expanded to the general community, because we shouldn't be giving blood products to people. And we were very involved in that. And as you know, we're very involved with the quality program at Baptist, with the national quality surgical program. And that's been the focus of our 34 years, along with a couple of stints as chief of surgery and chief of heart surgery and chief of thoracic surgery.
Wow, what a tremendous career. And you know, let's say 30 years ago when you were doing heart surgery, things obviously have changed drastically. And, you know, what do you think have been the biggest strides we have made, or you have made, or in heart surgery for both the patient and the healthcare provider?
Well, I think that one of the biggest things that we accomplished was as a result of the minimally invasive surgery, some of the techniques and things that we use in the operating room, where we put a scope down a patient's throat during the surgery to look at the heart using an echocardiogram machine and seeing the functions. When I started heart surgery, there was a 3% risk of people not waking up after the heart-lung machine.
Wow.
And that would happen. You'd do a perfect operation, and somehow the patient wouldn't wake up. As time went by and we started doing these minimally invasive surgeries and started using this echocardiogram, what we found was that we were leaving tremendous amounts of air inside the heart. And what would happen was that the patient did well, the air didn't go into the coronaries, but it went to the brain and the patient didn't wake up. Well, we've gone from a 3% incidence of stroke to a incidence of stroke, which is less than half of 1%. And that's tremendous for that 3%, because if you're 3%, it's 3%, but if you're one of those 3%, it's 100%.
Yeah.
So both the mortality and the stroke rate, the inflammatory responses of the heart-lung machine, doing beating heart surgery, which we did, and we found out that it was good for some people. And just the whole general idea of heart surgery has been transformed over the last 60 years, and in my experience over the last 34 years, into an area which it's pretty routine today.
Wow. And you guys are doing, like we talked about that heart lung machine where, and the first time as a student, I saw somebody's heart stop, and
Right.
You guys stop people's hearts, which is impressive. To be a heart surgeon, you have to have, I guess you have to have some guts and, because to stop somebody's heart, like when the first time as a medical student, I saw the heart stop, and then you guys bring the heart back. I was like, wow. But nowadays you guys are doing certain operations. Tell us about that. Certain operations where you never stop the heart, and you don't put people on heart-lung machines as well.
So in 1996, because of surgeons from Brazil and Argentina and also Italy, we started doing the procedure was called beating heart surgery. And what we did was we had different instruments which we would place like a little fork between the arteries. If you look at the heart's arteries, they're about the size of the veins on the back of your hand. You're talking about 2-millimeter vessels. And you have to stabilize it. You obviously can't sew that with a heart doing this maneuver. So we would stabilize the area locally and then do the bypass. We still do some of that, and a lot of it actually. But we found that the most important thing about the beating heart surgery, what it showed, was the use of this echocardiogram. Because obviously the technique of sewing something that's flaccid and totally still is a lot better than sewing something when it's moving. And there is some kind of movement at some point in time. So you have to be technically extremely gifted. So only about 25% of the country does beating heart surgery. The fantastic part about beating heart surgery is that it led to all these other things. And it increased our armamentarium so that certain people, you could only have a little incision on the side here instead of opening the entire sternum, which made the recovery 2.5 weeks to 3 weeks versus 6 weeks, which if you've ever had a broken arm, they put you in a cast for 6 weeks, right? So the same thing with the sternum with little wires. So you can't do anything. With this, your recovery time is much greater. Valves through a small incision, both aortic valves through a small incision up here and a small incision here, also have come a long way using that transesophageal echo that we're using in the operating room. So those are great advances that we've made in heart surgery over the last 20, 25 years.
So as a doctor, go ahead.
No, I was going to say, you make it sound that we have a difficult procedure, but if you notice, one of the reasons I went into heart surgery is because when I sew an artery, the blood clots around it. What you do, nothing clots, and it can leak, and that's a bad thing. So you have to be a lot more gifted than I do.
Definitely not. So obviously, as a doctor, we take a lot of joy and we love what we do, and we can remember great patients or great episodes. But in the last 34 years, what brings you the most joy? Is it taking care of patients? Is it your leadership? It's what you've revolutionized in 30 years in heart surgery in South Florida and throughout the country? Is it making me who I am as a leader today?
Well, I think all of it's important, but I got to tell you that the most important thing that I think that any physician receives as a gift from doing his specialty or his practice is to have like it happens to me almost every week now. I walk in somewhere and somebody says, "Hey, you operated on my aunt 20 years ago. Boy, she's doing great." And I always ask, "And how's she doing?"
Yeah.
Because you never know. But most of the time, thank God, it's like, well, yeah, my aunt, you operated on 20 years ago. She would now be 94. but she passed away from something
Yeah,
totally
of course,
different.
yeah.
But that hug that you get from a patient or a patient's family when and everything isn't perfect, no matter how good you are in anything that you do, 3% of the time you're not going to be that good, and that's just the way it is. But the majority of the times you're able to enjoy the fruits of your labor and able to save somebody and make them live a longer life. We're not God, obviously, although sometimes some of us might think we are, but we're not. And we're only as good as what he allows us, his plan to be. That's just the way it is.
All right. So we've made a lot of strides in 30 years. You said 60 years of heart surgery. What's the future of heart surgery? Where are we going? I've had other people here saying that there are some surgical procedures, not heart surgery, that may become obsolete because of great medication or other procedures. So, what's going to happen with heart surgery in the next 30 years?
Well, heart surgery is really a failure of medical therapy and a failure of getting to people and making them understand that there's certain things that they have to do so that starting when they're, young, they don't have to face something like that when they're old. So taking care of yourself, exercising, all those things that are said on television constantly are really important. Not eating at McDonald's, that kind of stuff is really important. Not eating fast foods, eating healthy, exercising, preventing yourself from getting to the point where you have to see somebody like me down the line. Now, there are instances where genes are genes and it's going to happen, but you can modify that therapy by doing by practicing good, sensible healthcare for yourself, by having a good primary physician that you go to, that you're comfortable with, that's going to take care of you over the years, and that he knows you, that you grow with them over the years. Those are things that are very, very important to prevent you from meeting somebody like me down the line, which is really what you want to do. You don't want to meet me because I'm a failure of medical management, medical therapy, and a failure of taking care of yourself.
Wow. Yeah. No, we've heard it time and time again on this show, eating correctly, exercising, sleep, very important to prevent a lot of medical problems we've talked about. Now, one of the things I know about you, because I know you personally and know you obviously as a colleague for the last 20 something years, is that you take the whole patient into account when you're taking care of the patient.
Absolutely.
And you understand that it's not only the body, it's the mind and the soul. So talk to us about your approach in taking care of patients and how that's important, that many of us, don't realize that that's important for the care of the patient.
Well, I think when you're going to do heart surgery on something, it's something very intimate. I mean, a lot of times I tell the ladies that I do heart surgery, I joke with her husband saying that I'm the only guy that's going to touch her heart other than them. And I think it's important that the family be involved in the whole process. A lot of times I get patients that come to the office and have nobody, and that's unfortunate. The other thing is that a couple of years back, I got really involved in looking at what happens to patients when they go under anesthesia. Do they have a positive attitude? It's extremely important to have a positive mental attitude. And, a lot of people know Dr. Oz, right? So he did a lot of work in the late 90s, early 2000s, and putting people into the state of mind, positive state of mind going into surgery. He would put, music in their ears that is soothing during the operation, making them very comfortable, trying to make them very comfortable. And those things are very, very positive. The nursing care afterwards, that the quality nursing care that's delivered. The nurses don't get as much credit as the doctor. The doctor goes, we go there, we operate, and we see them once a day. The nurse is with them 24/7, a different nurse, but 24/7. They're the ones that are real heroes taking care of patients more than the doctors. And I think they deserve a lot of credit, and their support is very important. Also, I think that, like I said before, the family support is extremely important. Depending on your faith, what you believe in is very important. We know that that people with a lot of faith a lot of times have better results than people that don't. The hope aspect of it is extremely important. Faith, whatever your faith might be and whatever God you believe, we have to take into account. I have prayed with patients because of the faith, and when they express that faith, whether it be Catholic, evangelical, whatever, Protestant, or of the Jewish faith, you have to understand what that faith is, respect it, and if they wish to do so, you can be part of that. And I think it's very positive. There's a lot of papers written on faith and families that have faith, and how their siblings do much better than families that don't, whatever faith that might be. To the extent that medical schools now teach a course on what's the word? Not necessarily faith, but spirituality in medical school for different faiths, different religions, etc.
So whose responsibility is it to bring it up? Like, we're the physicians, and then of course we're our audience, the patients. Should they bring it up to the doctor, say, hey, you need to know about my faith and my spirituality. How does that interlink with my hernia or my gallbladder or my heart surgery going to do for me? Or is it the responsibility of the physician to approach? Because what I've read is that the majority of patients would like to discuss their faith with their physician.
Well, it's a fine line, because obviously you don't want to cause a rift of any sort. But I think that knowing your patient, like when we were in medical school, they said the history and physical are 80% of the treating of the patient. Well, I think spirituality is part of that history and physical, and I think that's what they're teaching in the schools now, that there is a pertinent part of spirituality in taking care of people. So I don't find it awkward to bring it up with patients. Do you have a particular faith? There's, when you see them in the office, I'd like to meet with your family before we go to surgery. I don't want to take somebody to surgery, and there are patients that tell you, I don't want my family to know.
Yeah.
And I used to get into the habit of saying, I'm not going to operate on you if you don't have. Now, some people don't have anybody, and you can't do that. But it's ideal to have family members involved. And the bad experiences I've had have been when no family member has been involved, the patient is in, and I failed to say, I want your family involved, and then something happens and the family says, well, what happened? This was a straightforward operation. No, it's not a straightforward operation. It's heart surgery. People think that heart surgery is a straightforward operation, but it's not.
Right.
No matter how easy it is now, it's still that 1%.
Yeah, the only operation that's straightforward and simple is the one you don't have.
Correct.
Yeah, the moment you have an operation, anything can get complicated.
Absolutely.
Right. So what about the healthcare benefits? I've heard that if the patient has a positive outlook, and if they're supported and by their family, there could be less pain after surgery.
Absolutely.
There's faster recovery and so forth.
Yeah.
How do we help patients with that, or how do patients help themselves with that type of request?
Well, I think there's we work in an organization, or I worked in an organization, and you work in still, which is a faith-based organization. I think that's extremely important, to be working in a faith-based organization that sets that standard. You're going there because there is a certain amount of chaplains and things like that are around. And I think there needs to be, at least in our organization, a set of individuals that support that, that facilitate that to the doctor and to the patient. I think it's very, very important to have that.
Wow. And then what about the suicide risk? We're seeing so much suicide nowadays. We see it among physicians, we see it among the lay public, and obviously patients who get ill and they feel that there's no hope as well. where can we make the impact? We've seen it in our community with physicians
Yeah.
as well. What do you think is lacking? What is happening in
Well,
our
I
world?
think awareness needs to be, things like this need to be done more often, where there's more awareness to physicians, to patients, where patients get more aware of what's going on. I think it's very, very common to know that in faith-based families, the recovery from depression is a lot better. And that's documented in the literature significantly. So I think that getting back to the basics is an important thing. And I think those kind of things are basics to the human being, to the patient, to everybody.
Yeah, bringing God, like you say, any God, it's your God,
Yeah.
whatever God you believe in,
Whatever your faith is,
your
whatever
faith
you
is
believe
bringing
in.
it back into
Yeah.
your home, into your medical care, into
Correct.
your recovery, and
Absolutely.
so forth.
Absolutely, Tony.
So now, as somebody who's taken care of patients for 34 years, what type of advice would you give a patient who's seeing a doctor? We don't never, we give a lot of advice here about, checking, doing your mammogram, getting your pap smear, checking, your heart, checking your blood levels to make sure you don't have leukemia, lymphoma. But, general advice, what are the best patients, that you've seen in the last 34 years? And what advice would you give to our public that is going to see a doctor, whatever doctor they're going to go see? What are some advice that you recommend in kind of picking your doctor and in, like, say, interviewing your doctor just like your doctor interviews you?
Well, for young people, I would say that that you should probably look for someone more or less. I'm talking about primary care doctors.
Yeah. Okay. Primary care.
More or less your age, that you can grow with them. And most doctors are very good. I think you need to be aware and understand your body, your diagnosis, so that the doctor that you pick is sort of going to grow with you, is also has the knowledge that you're comfortable with, so that you can be taken care of appropriately. It's not what you want, it's what is needed. That, I mean, you need to want to be taken care of by an individual, but that individual needs to have the freedom to take care of you the way you need to be taken care of. So I think those things are very, very important. When you go to pick a surgeon, that's a different model. But I think we can, you should have the confidence in that doctor that you're seeing, that he's going to refer you to somebody, a surgeon, which is technically gifted or has wise decision-making choices in whether you should have an operation or not have an operation. So someone that's involved in the medical community that does that, I think is extremely important.
Now, what about, should the patient question the doctor? There was a period of time where you'd never question the doctor. Doctor said something, but nowadays, we have Dr. Google, online, and patients will always question, doctor, I don't want mesh. There's a lot of bad stuff with mesh, and I want my hernia repaired without mesh.
Correct.
Is it okay for a patient to question a doctor?
I think a patient should question if somebody is going to do something on you. That what is the reason? I think there is Google, and you're going to look at, and I think you need a doctor that's not going to get insulted by you asking him. Yeah. Because if a doctor gets insulted by you asking him, that in itself is a red flag.
Yeah. Lacks confidence in what he knows or doesn't know, or he can't answer to Google.
Right.
Correct. Yeah.
Or his ego is going to get in the way.
Yeah. No, doctors with egos are problems.
Yeah.
All right. So what do you see about, let's talk about medicine in the future. Obviously, more online. There's this telehealth medicine now. Obviously, we have a different generation. What do you see in regard to the future for medicine, for both the physician, someone like me, which, I guess I have like another 20 years of practice, and someone like our patients out there who are listening to us, who are seeking care? What lies in the future?
Well, I think telemedicine is good to get to know somebody over a conversation, over a television camera. But at the end of the day, there's nothing like putting your hand on the patient and getting a feel for that patient and seeing him. So I don't think online medicine is going to be the end with all. I mean, even in psychology, you have to have some kind of rapport personally that you're going to have at some point in time with your patient. So I don't think in-person consultation is going to go away. You know, when we were doing minimally invasive surgery back in the mid 90s, they were talking about cables and how you could run a robot in operation here and be doing an operation transatlantic operations. That really hasn't, you know, it ain't going to happen.
Yeah,
I mean, that's not going to happen. So we're not there yet. And I think that medicine continues to advance. I think that's the philosophy of medicine, is that you continue to advance. You don't, it's
Stay with the past. Yeah.
I guess, I heard this Judge Breyer the other day talking about America being an experiment. I think medicine is an experiment. That every day you experiment with different things to learn. Experience comes from
taking care of patients.
And that's the doctor gets better and better with more experience and knowledge and things that need to be ingrained in them. And there's nothing like putting a stethoscope to somebody's chest to hear a murmur. You can't hear a murmur over a television. Although now they have all these machines that are coming out that
on your phone you
can hear your murmur. It's
well,
pretty amazing.
I couldn't hear a murmur with a stethoscope or anything like that. I don't even know where my stethoscope is anymore.
There you go.
Yeah.
Well, you listen to belly sounds, don't you?
Oh yeah. Well, I put my hands on the patient.
I see.
Well, Dr. Moreno, Niberto Moreno, obviously a mentor for me. What are your parting thoughts, let's say, for the community, but even for me, I'm young. Remember, I'm young surgeon, a young physician.
Not as young as you used to be.
Yeah, not as young, right? But what are your parting thoughts for our community, and what advice would you give, young doctors out there?
Don't forget, for the young doctors, don't forget that the patient is the most important thing. And that is always should be center in your mind. Our care should be patient-centric. For the community, is preventative medicine is much better than invasive medicine. Stay on it.
Wow. Well, you remember the Schiff father and son, the liver experts.
Yeah.
And I got to meet Father Schiff at the age of 93 when I was a medical student at the University of Miami. And he tells me, one thing he told me many years ago: listen to your patient. They'll tell you what's wrong with them.
Absolutely.
And I tilted today, when we don't know what's wrong, I would tell the patient, what do you think is wrong?
Yeah.
What do you think is wrong? And I think that's the biggest problem that we have a lot with doctors. Think they know everything when we really don't know.
We need to listen.
Yeah, I need to listen more. So I love you. Thank you.
Thank you.
God bless you. And an honor to have you here. And thank you for the last 20 something years of bringing me up, and come by and meet us and see us at the hospital once in a while. And as for our show, Miami Community Health, I want to thank you again for joining us, listening to what has happened in 30 years of Miami's heart surgery program, and learning about, the full patient experience and taking care of the mind and the soul of a patient as well, besides taking care of their medical issues. So on behalf of Dr. Moreno and Dr. Anthony Gonzalez, thank you for being with us again today. And we're signing off from Miami Community Health.